OK, let's go back to that story we were just talking about a moment ago, the fact that Pfizer-BioNTech are expected to ask US regulators for permission to offer jabs for children as young as 6 months old. Dr. Bharat Pankania, I hope you can hear me now, sir. He's a senior clinical lecturer at the University of Exeter Medical School. Good to have you with us again, sir. Thank you very much indeed for your patience. How necessary is it to vaccinate children as young as 6 months old?
Well, now that we have got ample vaccine supplies, it is perfectly feasible to immunize across all the age groups. Before we had ample vaccine supplies, it was imperative that we immunized the vulnerable people, the clinical doctors and nurses and healthcare workers and other essential workers. But now that there is enough global supply, it is perfectly okay to give vaccines to the younger age group as well as immunize in other parts of the world.
Certainly the Western and Northern Hemisphere of the world will have enough supplies. But what are the concerns that rich countries, or at least countries in these particular regions, are going to continue essentially hiving off some of those supplies to the detriment of poorer countries, or countries in this, more often in the Southern Hemisphere, where children are less likely to have access to any sort of medical care?
That is a very big concern, and our richer nations must really improve their game, because they've already gone on to their third vaccines and in some places fourth vaccines, and they will not get better and they will not be any more protected unless they also protect the rest of the world and suppress infections in other parts of the world like Africa. Otherwise, variants of concern will keep on arising.
We are still, of course, in a situation where there are people around the world who are refusing to get vaccinated for whatever reason. One would imagine it's going to be equally difficult to get people who refuse the vaccine themselves to voluntarily get their children vaccinated as well. How much of a problem is that, and how do you persuade people to be able to get their children vaccinated if they're not going to take it themselves?
It is a tall order, but if I share with you my working example, because I've done this for 30 years, I used to talk to my patients. I used to explain to them the issues, address all their concerns and fears, show to them that on balance the vaccine is safer and it protects them. And then my patients invariably made a voluntary decision to be immunized. So I think public health, government health need to up their game and educate, inform, and allay people's fears about the vaccines and take them with them.
As always, we appreciate you being with us on Al Jazeera. Sir, Dr. Bharat Pankania, thank you very much indeed for your time.
Thank you.